Welcome to Pennsylvania in Focus. I'm Alan Wooten, Managing Editor at the Center Square. Joining me today is the Center Square's Pennsylvania reporter, Anthony Hennon. Anthony, we're talking today about opioid addiction and Pennsylvania expanding jail treatment. In your story at thecentersquare.com, there is a mention of 22% of opioid disorder. There's been no treatment. And what I'm wondering is, how was it determined that they knew they had a disorder? And then what happened? Was there not insurance? Were the doctors not able to provide the treatment? Did the victims not want to have treatment?
Yes, I think it's a mixed bag here. I think obviously there's a number who don't necessarily want that treatment. There's another group where they want that treatment, but they can't access it due to cost, or depending on where they live, it might not even be available to them. It really varies here. I think the bottom line here, as the National Institutes of Health and the CDC talked about in this new report, only 22% of Americans with an opioid use disorder got any medication to treat it. But this is also a general trend of most Americans who are addicted to opioids don't get any treatment at all, either with medication or with therapy, getting into some sort of rehabilitation program. A lot of this simply goes untreated. On the upswing here, on the bright side, it does seem like state and federal lawmakers or policymakers are putting more emphasis on this. When we're looking at Pennsylvania, a lot of this has happened within the criminal justice system. Back in, I believe, 2017, Pennsylvania brought on a full-time person within the Department of Corrections to kind of oversee expanding medications for opioid use disorder within state prisons. We've seen also a push within county jails to do the same. Because previously, it's a relative minority of county jails are actually offering treatment while someone is within a county jail. But now we're seeing more use of things like methadone programs, and they're also expanding the types of medicines that can be used. So there's 3 or 4 that are now getting into more common use within county jails and state prisons. So we're seeing more of a push of this. And even within the wide range of treatment programs across the state, you're seeing more and more use of what's called medication-assisted treatment to deal with this.
I think one of the things we want to point out for our listeners, too, is that when we talk about opioid addiction, it's not always people doing it for the high or the rush or whatever they get from the opioids. There are folks who have been on medicines for serious medical things going on in their lives, and then it's just a byproduct of medicines they've been taking. Would that be accurate? Yeah,
so I think it's shifted a bit. When we're talking 10 to 15 years ago, that was usually the more common route into it, I believe. You basically had people dealing with long-term pain, or they go in for some sort of surgery and they'd be prescribed opioids. But then, they form some sort of dependence on it, or the treatment may have been just too high of a dosage, and then they get stuck on that, and that kind of leads them into illicit drugs when they couldn't re-up their prescription. That's generally fallen off as the bigger cause, simply because doctors are much more aware of the risks, and they're much more reluctant to prescribe opioids in the first place for pain treatment. So that's been a shift. But now when we're talking opioids, it's not even heroin as far as dominating the illicit market. A lot of this now is fentanyl. It's essentially, especially in Pennsylvania, has really grown and taken over the illicit opioid market, as well as fentanyl, also known as tranq, which is an animal tranquilizer that's now more and more being used on the drug scene, unfortunately.
So as I'm sure that you're going to follow this story very, very intently, as you have before at thecentersquare.com. What is likely to be happening next? What would we expect to see either from the law enforcement and the judicial system, or perhaps from the lawmakers in Harrisburg?
Yes, I think it's a mix. Recent action on the state level, we've seen lawmakers decriminalize fentanyl test strips. We've seen a bigger push to make naloxone, or also known as Narcan, which is an overdose reversal drug, making sure that that's more accessible to people. We're seeing more and more, some drug courts popping up across the Commonwealth as a way to divert people away from the criminal justice system and into rehabilitation. But I think what we're going to really start seeing over the next 5, 10, 15 years as money comes in from the opioid settlement, the vast majority of those funds, about 70%, are being spent on the county level. So we're seeing this go toward things like traditional law enforcement of trying to target the supply on the street and get rid of that. We're seeing things such as an expansion of rehabilitation programs and getting more people into treatment. We're seeing that money being spent in a lot of different ways, either harm reduction of getting these test strips out to people, trying to work more with people on the street to get them into treatment. It'll be taking a lot of different forms, and it'll really vary, at least in Pennsylvania, from county to county. And hopefully these county health departments and other workers getting together and figure out what works, what doesn't, how we can improve this problem.
Does the one more question, the COVID-19 relief money is pretty much drying up and stopping as far as coming and everything. Mm-hmm. Is that going to impact some of the things that either maybe have been done or that could be done in the future?
I think at this point, not too much. We've seen some COVID funds that were getting sent out that was kind of filling these annual needs, not necessarily recurring needs. I think most of it, at least as far as Pennsylvania, was a little more generally health focused. But at the same time, with all this opioid settlement money coming into the Commonwealth, I think a few programs that were running on COVID funds are now basically going to get replaced by some of this opioid spending.
Good deal. Good deal. Listeners, you can keep up with this story and much more at thecentersquare.com. For Anthony Hennon, I'm Alan Wooten. Please subscribe, and thanks for listening.